Hi, my name is Mark Gabriel D. Marquez and I'm a medical student from Angeles University Foundation. And one time when we visited here in Certified Skin Authority, and I was fascinated about the non-surgical procedures offered here in CSA. The staff here are very accommodating and friendly, which makes it very welcoming and also intriguing for me as a client in taking one of their offers and their procedures. And for me, I tend to break out, and after having these breakouts, I tend to have these scars, pimple scars on my face, and these pimple scars give these little insecurities about me, especially when I tend to compare myself to other people, especially in social media. So in here, I find this good opportunity to remove these pimple scars and also to boost my confidence and make me feel good about it. So don't go away and stay tuned for the procedures that will be done by Doc Contessa.
Good day everyone! Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we'll talk about a very important topic and a very common skin condition we encounter in our clinic, the so-called acne marks or acne scars. So we have with us Mr. Mark Marquez.
Hi!
Yan. Parang yung topic is like acne mark and we have Mark. Okay, right? So it rhymes. Okay, so Mark here is how young?
22 years old.
22, very young po. So we know that acne problem starts from teenage years.
Yes.
And then it could progress at the age of like 20s.
Yes.
There's about 80% that at the age of 23, 24, 25, it would start to go down or decrease.
Yes.
So 80% of those who had acne problems at an early age, mga teenage years, 80% of them, it will just stop at mid-20s. But there's a 20% that they retain it. Okay,
yes.
So I think you are in that 80%. Kasi you're 22, so nare-reduce na yung mga acne or pimples. Although right now, I can still see mga blackheads, whiteheads, and then also on this part, meron siyang isang inflamed acne, inflamed pimple. Yan. I think it's because of the lifestyle. Yan. The others, lifestyle because of stress, lack of sleep, overwork, overfatigue, anxiety. Ayan. That's a common one. And actually, among men, because of their androgen hormones, they are the ones who have the percentage of acne condition na I could say nasa moderate to severe because of the androgen hormones. But the good thing with Mark, he did not suffer from those types of moderate to severe acne conditions. Kasi mild acne condition, mostly comedones and the non-inflamed pimples. So minimal lang yung merong inflamed acne si Mark, right? So let's ask Mark, what do you think are the the one triggering factors for your case na nagkaroon ng acne?
Well, for me, it's stress and also sleeping late po.
Yun,
Yes
sleeping
po,
late.
sleeping late. It became a really bad habit of mine.
Yun. I think a lot of young ones right now, because of the generation, computer generation, the
Yes po,
technology,
actually.
I think they stay late. They're on their, like, ano ba yan,
Mga
Facebook,
cellphones.
or meron ka chat. Yun. So those are the things right now. Actually, genetics, it can play a role also. So in our family, if we have some like parents, merong acne history, then that's one factor. Aside from the lifestyle, or it's not only acquired, but it can also be genetics then, okay? And for women naman, the use of cosmetic products, okay? For ladies also, the hormonal cycle, that's another thing. So for Mark, it's the lifestyle. Okay, so actually the main concern right now are the pimple marks, the remnants, the souvenir.
Yes.
Souvenir nung mga naging pimple dati. So the good thing, we only have a single inflamed acne here. Later on, we will be giving treatment for that. And minimal comedones, yung mga open and closed comedones, we'll have a treatment for that. So right now, we have a newer machine that will target those pimple marks. So it's a non-surgical type of procedure, and I could say minimally invasive, or very, very minimally invasive. It's not really the ones with those too much of long needles, okay? Kasi the condition is not that severe. I could say minimal to mild, okay? So, yung kay Mark kasi, we wanted sana po clear of all those souvenirs from pimple. And also, we wanted the acne to stop already. We wanted to, as much as possible, have a pimple-free skin, or acne-free skin, and a scar-free skin. And we want the texture of the skin to totally improve, and also the pores we wanted to minimize, and we wanted to have so-called oil-free skin, yung hindi oily skin, hindi na acne-prone skin, okay? And also, we wanted to balance the complexion, yung well-toned skin, kasi some people have concerns of yung aside from the acne marks na sunken scars or pitted scars, the others, ang concern nila are pimple blemishes, kasi I could still see also some pigmentations from the acne, right? So, yung mga acne blemishes. So, we'll treat all of those. Okay, Mark? So, I'm excited on the procedure that we will do to you.
Me too.
So, don't worry, it's not really a very aggressive one. It's, I could say, for me, it's painless, okay? So, ating ipakita ang actual procedure sa pagbabalik ng CSA Certified Skin Authority. And we're back, mga ka-CSA. So, we're still with Mark here, okay? So, the actual treatment that we will be doing will be the so-called RF fractionated micro needling, okay? So, this is another aesthetic device. It's new here at CSA, and it's targeting the reticular dermis. That's the one we need to reach to be able to induce collagenesis and the formation of new tissue matrix or connective tissue matrix. So, we have our machine here. This is the RF fractional micro needling. It's a brand called Ensemble. Okay, so the screen there, it's a touch screen. So it has some of those parameters there. So what will be the power, and then the duration, the time, and also some interval, and like if it's a repeat treatment or not. Okay, and the face there is telling us how much of the strength and also the depth of the needle that we will be using. So, meron siyang part na forehead, under the eye, the mid-face or cheek area, corner of the mouth or the jowl area, the chin, and also under the chin, the neck part. So, pwede rin siya sa neck area, face and neck area. For Mark, we wanted to target the entire face because forehead area, we also have pimple blemishes here, temple region, mid-face, okay, the cheek area, nasolabial area, lower face, so the mandibular area, and the chin part. Okay, so if you're gonna assess the so-called like split face assessment, sometimes we check which area has more acne scars or acne marks. And looking at mark, I think there are more of the bigger ones here, and on this side it's more of like a pinpoint and more of like blemishes. Okay, before we start, Mark, do you have any questions? Any questions for the treatment? Have you heard something about our procedure, the RF fractional microneedling?
I heard that it reduces wrinkles also.
Yes. That's a very good input. Yeah, nag-input na si Mark. So, it can also treat wrinkles, lines, fine lines, and even sagginess. So, it has an anti-aging benefit because it will reach the dermis where you will synthesize new collagen fibers. So, it's going to tap the dermal fibroblasts. So you will make the newer collagen and newer elastin. So aside from treating acne marks, acne scars, acne blemishes, it's also anti-aging. It's gonna treat fine lines and wrinkles. Actually, I did had a patient before, 19-year-old male, who came to me with a complaint of forehead lines already. 19-year-old male who already had wrinkles on the forehead. So that's an early aging, right? So this is like, wow, it's like it has bonuses, it has extra benefits. Okay, kasi aging starts now, right now, 25. Before 35, now 25. Baka next time 20 and then 15. Okay, so you're in 22.
Yes.
Okay, pero looking at Mark, forehead region, ooh, I can see minimal lines already. Oh, talagang ang batang to masipag. Okay, because really, aging right now is accelerated by our lifestyle. If we are really so stressful, we lack sleep, and then we're overworked, over-fatigued, most of our cells are also overworked, then that will lead to premature or accelerated aging. Okay, so then, the moment you notice already these signs, then we have to do something to combat this and prevent it. Okay? So, the earlier you start, the better also. And this is part of our skin care, the health of our skin. Okay? And of course, we wanted to make our skin clear also. This will boost our confidence. So,
yes.
Most of the patients that I worked with, really, it boosted their self-esteem, self-confidence. They were saying, if you look good, you feel good. You really feel great. Okay, and the more you become productive, and then like when you face other people, and then wow, we were saying like you are looking great, and it's like boosting ourselves too. Tama, Mark?
Tama po.
Yeah. So right now, what we're gonna do is, we'll be using this machine. A while ago, we did cleansing of the face. And after we cleansed the face, we applied topical lidocaine cream. We left it for about 45 minutes. And then the position that we need is that Mark should be in a like flat bed position. So lying position po tayo. So this is our motorized bed. It can lower the head part. Okay, so everything right now is push button na po. So yung bed natin, push button lang, ilo-lower na po niya. So the target of our machine, as I've mentioned, Mark, is the reticular dermis. So it has some multi-depths too, meaning to say certain skin depths that the tip of the machine can reach into. Like we have layers of our skin, right? Epidermis, dermis, subcutaneous fat, or the hypodermis or subdermis. And below that, we have some muscular, fibromuscular layer, or even the fascia also. Okay, so I have here the ensemble RF microneedling. So the handle is here. Okay, the handle is here, and then it has tips that will that contains your microneedles actually. So, meron siyang mga tiny needles, okay, certain tiny needles, and this is like a square type tip, and the tips are usually the insulated type of tips. And the tips of the needles, they will emit the laser, the radio frequency laser. Once they reach the reticular dermis, they will induce a so-called thermal coagulation. And those are called TCPs, or thermal coagulation points. And they will stimulate the synthesis of new collagen fibers, new elastin fibers, and the new connective tissue matrix to improve those scarring or those sunken marks, to create new tissue matrix and then close those sunken scars. Make sense, Mark?
Yes, ma'am.
Nakuha po?
Yes,
Yes.
po.
So, some of our lecture already here. So, the needles have certain depths or multi-depths, okay? It starts from 0.25 millimeter to about 4.5 millimeter, okay? So, if we want to reach our dermis layer, the certain length, actually, you should go like 2 millimeters. So, for Mark, it's our first treatment, first session. We can start with the 1.0 millimeter, okay? And it still will vary depending on the depth also of the scars and the type of the scars. So we doctors will have to diagnose the specific scar condition. So for now, I'm starting with the 1.0 millimeter depth, and then this is a very versatile machine also, okay? And then I can work on with the chin part, the skin on the chin part first. So this machine has the radio frequency technology also. That's why it has the benefit of anti-aging. Those with saggy skin or wrinkling skin, they will also benefit from this one. So not only the acne marks or acne scarring, but also the aging skin. So after this procedure, it's normal to see some redness on the skin and a little bit of skin elevation or like skin edema, a minimal one, but that will go away in a little while, because we also combine this with our Healite machine or our cryotherapy machine. So after this, we ask our patient to avoid sun exposure, stay indoors at first, and do ice compress on the face. And when you go out, like there's a need to go out, just apply your topical sunscreen. Okay. So we really have to target the acne scar area, and we expect to see some pinpoint bleed because we have microneedles here. So it's also ideal to work on the jawline area because I can see pimple marks on the jawline also. Okay. So they were saying no pain,
No
no
gain.
gain. More pain,
More gain.
more gain. Okay, so now I'll proceed to the left side. Okay, I'll start on the mental region first here. So I think this is a tolerable treatment for Mark.
Yes, ma'am.
Yeah. Now this one has a very good advantage over the old CO2 fractional laser we were doing before. For individuals who are prone to have post-inflammatory hyperpigmentation, that's the effect you get from CO2 fractional laser. So with our RF microneedling, we minimize the effect of post-inflammatory hyperpigmentation. So if our patient is prone to having blemishes or pigments, we rather prefer to do this procedure for them. And the good thing with this is, as we have mentioned, it has added benefits of anti-aging. Okay. So I'm targeting lower face and mid face. Okay. So once we have already passed certain areas of the face, we have created already so-called microchannels. And then we can repeat the procedure for this kind of treatment modality. It can be repeated every 3 to 4 weeks. because we give time for the skin healing, skin recovery. Some of our patients, we combine this also with the so-called PRP or the platelet-rich plasma. The plasma containing the platelets help in the faster skin regeneration and skin healing. Because our platelets, inside them, they contain granules, and those granules also contain kinda like stem cell peptides or growth factors. Okay, so there's already redness and also noticeable skin elevation, which is a normal effect from this kind of treatment. So I'll be moving to the forehead region. I can decrease the depth. So actually I started with 1.0 and then 0.75. I can make it 0.5 depth. Okay, because the skin here compared to the other parts of the face, of course this one thinner. Okay, so we have thinner tissues here, so and it's bony, so we have to also be careful on the forehead part. So I'll do middle first, so medyo we have to kind of try to tolerate as much as possible. If you see your patient having this reaction, you can still lower the depth of the tip. Okay? So Mark, okay lang. Yan. I made it 0.25. Okay?
It tickles though.
It tickles. Okay. That's a good sensation. Ticklish po si Sir Mark. Okay. So basically we do like number of shots. We can already see the counts, the number of shots that were delivered. So how many shots were delivered? So okay, we are now on the 112 shots. Okay. So in one treatment, some cases we start with 100 shots, 200 shots, 300 shots, and if we include the neck, it could be 400 to 500 shots. So you can also do this in our neck area or the so-called décolleté or the upper chest area. Those people whose concern is the aging on the upper chest area. So like people who love to wear like blouse that are lowered or like plunging necklines, then if they want to show the skin very rejuvenated, then they can do this kind of treatment. This kind of aesthetic device can also be beneficial for them. Okay ka pa, Mark?
Yes, ma'am.
So Mark is relaxed. Okay, so for our patients, when we do procedures like this, we give them list of home care instructions. Kasi most of the patients are asking, Doc, ano pong bawal after? So we give a list of instructions or reminders and what to avoid, what food to eat and not to eat. And then we give them like a schedule for our follow-up. Okay. So we have an active acne there. Later on, we'll just give an anti-inflammatory injection for that one. Okay, I have to avoid it. Okay, so we've done forehead and temple region. Now we can also proceed to the nose region. So nasal area, some people have these open pores on the nasal tip, right? So they also wanted to improve the skin texture on that part. Still okay?
Yes, ma'am.
So we're nearing the final procedure. So the tip that we use is individualized. So it is a sterile tip, and ideally this is a single-use tip only because it has needles. So it's very important that doctors are observing a so-called aseptic procedures. Okay? So remember, this is a procedure that has needles. Okay? So we are making use of sterile, single-use needles. Okay? So we have done a total of 164 shots already. So right now, we can already proceed with a Healite machine, a machine that will give a faster relief, like the reduction of the redness of the skin as well as a so-called cutaneous edema, a very temporary edema on the skin. So, ating pang ipapakita ang hilay treatment ni Mark sa pagbabalik ng CSA Certified Skin Authority. So, we have done the ensemble treatment, RF microneedling for the acne marks, and then we followed it up with our Healite machine to reduce the redness on the skin and as well as to also make those skin edema go down or become flat. And right now, I have noticed that the redness had gone down, and a while ago I was seeing some like edema marks on the skin. It had minimized already. Yeah, nice. Okay, so how's the experience, Mark?
With the Healite po, ma'am, it was very relaxing.
Right.
I can feel the heat radiating all around the portions of my skin, and then it's overall it made me sleepy because it's so relaxing.
Yeah.
You will like it too.
Yeah. Okay, so a while ago with the RF microneedling, so how was it? Like the sensation when you were feeling the needles coming into the skin, how was it?
Well, at first it took me by surprise when the needles just went in, but the feelings just only a little pinch.
It's a little pinch, right?
It's very tolerable. I was surprised that it was really tolerable, especially when it goes around the face, because the rest is just like little pinch. That's it. Nothing to worry about.
Tiny ant bites.
Yes, tiny ant bites. Actually, it's less painful than a tiny ant bite.
Ooh,
yes.
So mas masakit pang kagat ng langga.
Yes, take note.
The forehead part, how was it?
In the forehead part, yes, there's we know that there's only lesser amount of skin, layers of skin there. Doc here, she minimized the depth of the needle to 0.5, and it's just right. Actually, there are some portions that I didn't feel any pain.
Okay.
And some there were just the same old pinch, but it's just it's a lesser pinch now because the minimized depth.
In terms of the effect, the result of this one, there will be a gradual improvement as time passes by. As we have mentioned a while ago, the microneedles were tapping the reticular dermis where we have a lot of cells there like fibroblasts that will synthesize new fiber proteins, and these are responsible for skin tightening, skin firming, and also closure of pores, and at the same time the improvement of the acne marks, okay, and the lines and wrinkles kasi collagen stimulation din siya eh. So the repeat treatment actually is after 3 to 4 weeks for the same kind of procedure. Now this kind of aesthetic device we also combine with the LaceMD, another type of a machine. It's a 1927 thulium laser na meron ding parang fractionated laser. I like it also because we combine it with some products that can lighten blemishes. Because you're creating microchannels, and the good thing, the products that we apply, they can easily enter the inner layers of our skin. So like in a week or two, we can do that LaceMD combined with this procedure. So mga ka-CSA, maraming salamat po sa panonood ninyo ng aming mga episodes. Marami po kaming mga topics. Actually, we have a lot of our videos in our YouTube channel, only type Contessa Salvador. At kung meron po silang mga katanungan, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the second floor, Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0917-504-4268. I have my Instagram, doc_Contessa, and then FB, Contessa Salvador Alapag. And if you want to also see the photos of Mark, the others kasi are asking, how's the result? How was the after 1 week, after a month? You may wanna check on Mark's FB or Instagram.
Facebook and Instagram, yes.
Yeah, would you wanna share?
As for my Facebook, you please type Mark Gabriel D. Marquez. On Instagram, it's only Mark Marquez with double Z at the end. No space.
And some of our clients are also interested. They want to ask questions din dun sa mga naka-experience ng ating mga procedures. So I think Mark can also help you or share with you how was it after a day or after a week, and was it really effective? That's the most important thing.
Yes.
So they asked us, talaga bang nagwo-work yung mga procedures sa CSA? So thank you, Mark. I think you will be able to help a lot of our televiewers. Kasi marami rin talaga dyan, they really wanted to have improvement on their face, and the others are already going through a so-called like depression, or it affects their daily living, low self-esteem, low self-confidence, na the others parang feeling nila, the others pa nga sabi nila parang ano ako, kawawa naman ako, or yan.
Self-pity.
Self-pity, yan. Tapos parang ang hirap daw makahanap ng trabaho, ang hirap makahanap ng asawa, kasi daw maraming ganito sa mukha. Yun. So, hopefully, you'll be able to help them also and share with them mga skincare regimen and your experience with CSA. Thank you, Mark. God bless you. And thank you sa inyong lahat po. God bless you. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.